So thank you all for joining us today, community members, members of the press. We really appreciate you all coming out to hear about this very important topic in this press conference manner. It has been heavily on all of our minds since March, the pandemic and the urgency of it. After a few months spending trying to figure out how we protect each other during this pandemic, I think we all understand that we at some point have reached a collective fatigue around this COVID-19 virus. There have been a lot of mixed messages from state, federal, even here at the local level. And it's been a very confusing time to try to figure out how to keep yourself, how to keep your families safe. Businesses have had difficult times trying to figure out how to operate and how to keep their patients safe. And all along, the local Charlottesville community and some of the leaders in it have been trying to figure out how, even with those messages and with us being a Dillon rule state and not being able to make maybe all of the decisions we would like to be able to make, how can we do our very best in keeping this community safe? Since about mid-June, that collective fatigue, I think a lot of us have been experiencing, has been coming into play, and there have been large community gatherings. There have been smaller gatherings that we've been concerned about in the past, everywhere from mothers meeting up to walk their babies together, even though they didn't live in the same household, individuals meeting up at parks to play soccer, kickball, baseball together. I think what we are experiencing now that's so concerning at this time is we're having gatherings with hundreds of people. And we are very concerned about the numbers spiking in our area. And it's very important for us to figure out how we can come together as a community, even though we may be getting those mixed messages, and do what is best for one another so that we can keep each other healthy and alive. Today, joining me and who will be our next speaker is Mr. Eddie Harris. And Mr. Eddie Harris is going to talk to us a little bit about what is COVID-19 again, just as a refresher. Mr. Harris.
Thank you. COVID-19. COVID-19 is a highly contagious virus that spreads in the air and can cause breathing and other serious health complications, including death. Contrary to what some people may think, people of all ages have got the virus. So everyone is at risk. Some people have no symptoms and pass it on to others who get very sick or die. Testing for the virus after being exposed might not register a positive test for between 2 and 14 days. An increase in cases could lead to shutting down businesses again and forces officials to have another stay-at-home order. So this is something that's very serious and it should be taken serious.
Thank you, Mr. Harris. And next up, we'll have Dr. Bonds.
Yes, thank you, Mayor Walker. I just want to update everyone on where we are in our community. For the district, we've had just over 1,200 cases of COVID-19. 100 of those individuals have been hospitalized, and we have had, unfortunately, 29 fatalities from this disease. In Charlottesville, there have been 285 cases with 18 hospitalizations and 7 deaths. We do see, when you look at who is actually being impacted by this disease, an overrepresentation of communities of color amongst our cases. 16% of our cases have self-identified as African American, and 32% have self-identified as Hispanic. We also see an overrepresentation in hospitalizations, with 45% of our hospitalized cases self-identifying as African American and 17% as Hispanic. Most of our fatalities have been amongst our older individuals, and again, we see an overrepresentation among African Americans. We are doing a lot of testing in our community, and we have been seeing an increasing percentage of positives amongst those that test. Currently in the district, about just between 7 and 8% of individuals that get tested for COVID-19 end up being positive. I know that there has been some concern about what happens when you make a complaint about an institution or business that's not complying with the mask order. Those complaints do come to us, the health department. To date, we've had 180 complaints. Almost all of them are related to individuals not wearing masks in either retail establishments or restaurants. Our policy right now is to inform and educate for the first few times we get a complaint about a particular organization or a restaurant. If the complaint continues and it's an agency that we are responsible for regulating, we do have the authority to issue more serious compliance orders with that. If it's a retail establishment that we do not regulate, then we're going to refer those to the organization that does regulate them. So overall, we're seeing an increase in the number of cases, an increase in the percent of individuals that are positive, and we continue to see outbreaks in our long-term care facility and congregate living settings. Thank you.
Thank you, Dr. Bonds. Next up, we're going to have Ms. Stacy Washington talk about her personal journey with COVID-19.
Thank you, Mayor Walker. I stepped outside the box for the 4th of July weekend. My birthday was July 6th. I normally would just sit in the house with my family, and I celebrated. I told myself I can take my mask off for a couple of hours and be in my backyard and celebrate with me.
I'm on this video thing.
And
Bye.
a couple of days later, I woke up out of my sleep and I could not breathe. My spouse had to catch me before I collapsed into the middle of the floor. So boy, was I wrong when I thought that I could take my mask off for just a couple of hours to celebrate. COVID is no joke. I was not taking into consideration the fact that I have to be around other people, and other people in my house were infected with COVID. My body ached with pain. I couldn't sleep. Quarantined in my room all alone. I can't spend time with my 11-year-old son. It's very, 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 very serious. And this community isn't taking it serious. Just for a day, a couple of hours of being around people, it's really not that serious. And I took it for a joke. I really did. And I'm regretting it every day, every moment that I've been sitting in this room, I've been regretting it. Everybody that I put in danger, I've just really feel so bad. I've had so much time to think about it, and it's just not worth it. When you go outside, you say, I can't breathe with this mask on. I'm going to take it off. Try breathing with COVID. Try breathing. And I have an underlying health condition, and I play with it. I played with COVID with epilepsy. I could have very well contracted COVID and had a seizure. I could have passed it to coworkers, their families. They could have took it home to their families. I mean, it's very insensitive for people to even go out and do it, and you don't take into consideration of other people. You don't even consider the other people. When you think about you're just thinking about yourself. That's not fair. It's really not. People need to get serious about this. The numbers are climbing. I just checked my inbox this morning and somebody inboxed me and said, hey, Stacy, where can I go get tested? I've never came into contact with this person. They said, hey, Stacy, I feel so horrible. Where can I go get tested? People are reaching out to me because they feel comfortable because they know I came into contact with it, that I'm positive. We really have to make a change, and we really have to take it serious. And I just want to let everybody know, like, if we don't have to be outside, we don't need to be outside. It's really serious. And I did not think, honestly, for those couple of hours that I took my mask off, I said, I'm all right. And I wasn't. I really wasn't okay. I wasn't. And I just want everybody to know that it can happen. It can happen to you. It can happen to any of us. So we need to be safe. We need to get educated on this virus because it is serious. And I don't know when this is gonna subside. I really don't. So we need to get serious about it. We need to mask up, put the gloves on, wash our hands. If you feel sick, stay at home, don't go to work. If you come into contact with somebody that's positive, get tested. Please, let people know, stop hiding it. Because people, I mean, what are you gonna be, a serial infector? Like you just gonna go around and be, okay, you have COVID and you just still gonna go outside, and everybody just get infected. It's not fair to people. So let's just please educate yourself on COVID and be safe, y'all, please. And that's just what I want everybody to know.
Thank you very much for sharing with us.
You're welcome.
Thank you. Next, we have Mr. Alexander, and he's going to talk to us a little bit about how to keep ourselves safe again. Just a refresher, I know this information has been going out into the community for the past few months, but we all need a refresher. There were questions coming in and people sending messages on Facebook over the weekend. We had some concerns about the UVA students coming back into the community. And one of the first pictures that start floating around on Facebook was a house party up on campus. And so we understand that there are reasons, to be alarmed and reasons for all of us to be concerned. So Mr. Alexander is just gonna give us a little bit more information and a refresher for some of us, new information for some of us, hopefully not a lot of us, about how to protect ourselves against COVID-19.
Hello, everyone. Are you able to hear me? Are you able to hear me, Mayor?
Yes.
Yes, sir.
Okay. First and foremost, I would like to thank you. Sorry about the camera issue, but I want to thank you for bringing the forces together to deal with this important issue. Initially, back in April, I got a call from one of the doctors, African-American doctors at the University of Virginia Hospital, Dr. Webb, and she was really upset about how the virus was affecting people of color. And she said, Miss Alexander, I need your help. And I told her, no problem. And thus we created what was called Staying Alive, spread the word, not the virus. It dealt with information. And I never forget one of the doctors, Dr. Hilton, had mentioned to me about having sort of, the paraphrase, it's getting real. And I said, no, Dr. Hilton, I can't go along with it's getting real, it's real. And at that time, it was 30,000 deaths at that time. And at the present time, it's 135,000. So in mentioning it and talking to folks, Staying Alive was back in April. And when I got a call last Friday, how can we bring this message to the community? Not only about staying alive, I was thinking over the weekend, do you want to live? So in mentioning to the group, and hopefully we can extend this campaign to wanting to live. COVID-19 doesn't care about you. COVID-19 doesn't care about age, area code, or zip code. So I'm excited in working with the group in terms of getting this message out to the community to do the right thing. And Stacy, I want to applaud you to come forth. Who knows how many lives you may save down the road in terms to let people know that this virus and it's real. So I'm looking forward to spreading that message, wanting to live and challenging the people in Charlottesville. And I also think this message, want to live, can be a model for other communities beyond Charlottesville. So I'm just glad to be on board and will do anything I can to enhance the effort and save some folk.
Thank you, Mr. Harrison.
Thank you. Next up, we have Dr. Janita Richardson. She's a professor at the University of Virginia, but she's been working in the community for the entirety of this pandemic. And so I'm so thankful for her to make sure that communities, Black communities and other communities of color are getting the attention that they need. If you remember the numbers that Dr. Bonds just went over, the 16% in the African-American community and 32% in the Hispanic community, and we've heard those statistics nationwide, and Dr. Richardson has made sure that in this community, as a community member, do it with her work with FAR, the Public Housing Association of Residents, that people who are most vulnerable to this disease, to this virus, are protected and that their well-being is considered. So thank you, Dr. Richardson. And would you talk to us today about just next steps and what testing in this community, what the options are there, and then anything else that you would like to share?
Thank you, Mayor Walker, and to my fellow panelists. The first thing I'd like to do is to remind everyone about what you can do to protect yourself. This is not new information, and there have been lots of organizations that have tried to help and share with distributing masks, distributing the children's book that Drs. Webb and Hinton created. But just for review, masking is important. It protects you from other people and other people from you. So even if you don't have a perfect mask, wearing one is better than not wearing one. Please make sure that it covers your nose and your mouth. It lays as close as possible to your face, because what we understand is that this virus spreads through the air, and so it attaches to your mucous membranes, and that's how you internalize the virus. Secondly, the business about social distancing, and we've heard about that a lot, it actually matters. And what I'd like people to understand is that's just not a number that fell out of the sky, but there's research behind that. And there have been tests to see how far what comes out of your mouth goes when you talk, when you shout, when you sing, when you speak to other people. And so that social distancing is very important. And so if you have a picture in your mind about how long a couch is, that's about how far away you should stay from everyone else in a 360-degree view of yourself. The other thing I'd like to emphasize before I share with you where the free testing sites are this week is that just because you've been tested before does not mean that you are safe. So the test that you take is one moment in time. And as an example, if, for example, you were tested in March or April or May, or even early June, and you had a negative, and then you intended these events such as Stacy, Miss Washington just talked about, you need to get tested again. So the testing is only as good as that moment in time. So we're strongly encouraging anyone who has been at events between mid-June and now to make sure that you take advantage of the testing that is coming your way. The Centera Martha Jefferson is offering free testing on Thursday, this Thursday, from 5 until 7 at Washington Park, at Booker T. Washington Park. So they have agreed to 250 tests, which is double what they have normally been able to provide to the community. I strongly encourage people get there early and make sure that you get tested. They are also offering that event again in that same location on the 23rd of July, which is the following Thursday. Also, the University of Virginia is sponsoring testing at Buford Middle School on Saturday from 2 until 4 p.m. And any additional testing information that you need, you can get from Dr. Bonds at the Department of Health. There is a paper summary of what we've talked about here today that's going to be widely distributed, much like the Staying Alive flyer that went out, and with updated information and with information about the testing. But if I have anything to share with you, it is mask up, social distance. This is not a drill. This is about saving your life and saving the life of people that you love, and take advantage of the free testing that's available this week. Thank you, Mayor.
Thank you, Dr. Richardson. And next up, we'll have Dr. Teron Richardson talking about just the city response to date.
Thank you, Mayor Walker, members of the panel, and also to the individuals who are here. That's our guest. I'd like to say first and foremost that we've been dealing with this since March, and we've been making adjustments all the way through in terms of how we operate as a city. As many of you know, that we've been doing a lot of teleworking since the March timeframe, and we continue that until today, and we'll continue to do that. The state has gone into phase 3, but we remain at phase 2. We did that to ensure the safety of our employees as we continue to move forward. Right now, we are in the process of slowly, I mention that again, slowly bringing back our employees to work, but still maintaining that phase 2 approach. Our first 2 groups that we've actually brought back was our Commissioner of the Revenue, as well as our Treasurer's Office, to be our first approach in this tiered process, what we're utilizing in terms of bringing our staff back. As you can see, I'm wearing a mask because that's part of our new policy in terms of if we leave our desk or we have someone come into our office, we are to wear the mask as we traverse throughout our hallways as well as in our workplaces. This is something that we went to ensure the safety of all of our employees who are here within our facilities. On another note, in terms of what we're doing, we've done a lot as a city in terms of trying to provide funding for different areas throughout our community. In terms of the CARES Act funding that we received. Recently, we received $4.1 million in CARES funding. We put that into 5 categories. 1 was business, 2 was for community support, 3 was for operational modifications. The 4th one was for employee support, and the last one was for technology. These were all things that we felt that was necessary in terms of us ensuring, number one, that our community was provided with funding in terms of housing and feeding programs and different things like that, as well as the business community, providing them with some incentives to get them back on their feet. And then also to our internal processes and how we operate on a day-to-day basis, and making sure that we have the necessary safety equipment for all of our employees to be able to come back. And that's of paramount importance in terms of when you're talking about bringing people back into the workplace and ensuring that everyone is safe as well as trying to provide necessary technology for our employees that usually have to go out to different homes and different things like that, where they have the necessary technology to be able to communicate with our community through various means through our technology. The other thing is that we've done too is we've gotten CARE Act funds for our CAT, our transit system, to ensure the safety of our drivers, as well as those who utilize our bus services for medical appointments and different things of that nature. We also provided additional funds through our Pathways Community Resources Hotline. We've added an additional $400,000 to that. So on the city side, we are trying to do our best in terms of trying to ensure that our community is safe, as well as our residents are provided with the necessary resources to keep them going. And we'll continue to do our best to ensure that as we move forward with different things that we can continue to do for our community. But as we always talk about, we want to take care of the most vulnerable populations, as well as, our employees, and making sure that we're taking care of everyone as much as we can. And, I'd like to thank our regional partners who we've worked with since day one. That's inclusive of UVA and Dr. Bonds, as well as with the county. We set up our overall operations plan to be able to work through this pandemic. And a lot of us thought it was going to last a whole lot shorter, but it seems to be lasting a whole lot longer. And that's one of the things we want to do here in the city, and we continue to do, is manage our financial resources to be able to, prolong our financial means throughout this entire pandemic. We're being very careful in our overall expenditures as we move forward, because one of the major things that the city council want to do is to ensure that everyone continues to work in our city, to make sure everyone has a paycheck. So that's what we've been trying to do to ensure that we are managing our overall finances to be able to do that. I'm not going to continue speaking. I don't want to take up too much time, and I don't want Mayor Walker to cut me off. So I'll turn it back over to you, Mayor.
Thank you, Dr. Richardson. And I wasn't going to cut you off. And so again, before we go to questions for the press, I want to thank the panelists today. Again, I received a lot of calls last week, and I started sending emails that the subject was titled Tipping Point. And immediately, Dr. Janita Richardson, Miss Jackie Martin from Centera, Dr. Bonds, and myself, we were on a call early Friday, and I talked to all of them at least twice on Friday to figure out what we could do in terms of increasing testing capacity and getting the word out. So I really appreciate the three of you working with me Friday and this morning. And again, Eddie Harris, thank you as usual. You always say yes, and you always come through, and he's so passionate about the community and making sure that after this pandemic, we're still here. And thank you, Mr. Alexander, for always being willing to get make sure that people get the message out, and with the way you create your pitch in a way that they can remember. And Ms. Washington, I really appreciate you. I know it's difficult to come on and share your personal journey, but I really appreciate you coming out and sharing it. So I really thank you all. What I'll wrap up with before we take comments from the press is this. If someone said that there would be a nuclear bomb launched, and what would you do? And even though this may seem like it's different, you don't know if you will come out of this alive. And even if you survive it, you don't know if a family member, a close friend, your kid will survive it. We don't know. No matter what we're doing at this moment, there is no public health official in this country who would tell you with 100% certainty anything other than that this virus is lethal. That's the only thing they will tell you with 100% certainty. Everything else we're guessing at this moment. There is some science behind it, but that science is being clouded a lot by the politics of things. And it's important for us to understand that sometimes politicians get in the way, and I'm here as a politician telling you that. So at this point in time, the only thing that you can do is the same things that we knew back in March, was to stay home. Every order that the governor has put out has still had the title that says safer at home. And that is a mixed message, and it has been confusing when you can go out and then gatherings can increase up to 150 people, and churches can, capacity can be at 50%. But we all know that we've caught colds and flu in these settings, and we can catch COVID in those very same settings. So it's important for us to just understand that while the public health community is trying to wrap their minds around this virus and do the research that it takes to get us reliable information, it is up to us to minimize our potential exposures and do the best that we can to keep ourselves safe. And we all want to be out. We all want to be with our family. We all want to be with our friends. And this is temporary request that you do that through your phone, your computer, as much as possible, and limit those physical interactions that you have with your family and loved ones, so that at the end of this pandemic that we can be together and we can have those events, and you're not sitting in mourning of someone who's no longer there because of this virus. And Mr. Willer will take questions from the press.
Thank you, Mayor Walker. We've got 5 local journalists on with us. If you have a question, just click the raise hand icon and I'll call on you. Be great if you started with your first question, and then if you have a follow-up, that's fine. But after 2 questions, then let's let someone else take a turn. We'll circle back and touch base with you one more time after that. So first we have Nolan Stout with the Daily Progress. Let us know who your question is for.
Hi, this question's, I guess, for Dr. Teron Richardson and Mayor Walker. Has the city considered, or is the city considering asking the governor to allow us to return back to phase 2?
Yes, yes, we are. We had that discussion last week. Dr. Richardson then followed up with the county. Because of our proximity, it is difficult for the city of Charlottesville to do anything in isolation. And Dr. Richardson, if you want to finish that question based on your conversation.
Yes, thank you. Thank you, Mayor Walker. Yes, we're supposed to be having a meeting today where we have our regional team meeting, which starts about another hour. We'll be having that discussion. I've also, from that, been able to talk to my counterpart, the other Richardson, Jeff Richardson, pertaining to that. So we'll have that discussion very soon.
Nolan, did you have a follow-up?
I was just going to ask my second question, if that's
sure.
Fine. You mentioned that there were large gatherings that could have hundreds of people in them. I was wondering what kind of gatherings you're talking about. Is it church, private gatherings, house parties? Is what you're seeing?
Oh, okay, now I'm on. The information that we received, there have been several events from about mid-June to even last weekend where people are gathering at parks, house parties. There have been parties in some neighborhoods, which I guess would be considered the block parties. And then I think we all saw the house party that has been going around going around social media in regards to UVA, maybe some UVA students. I haven't verified that photograph. I don't know if it's actually something that's not doctored. So I'm just saying that we've seen it. So yeah, there have been quite a few reports of a lot of activity that could lead to a spike in cases.
Next, we have Riley Wyant with NBC 29. Go ahead, Riley. And you'll have to unmute.
Oh,
There you go.
I see. Thank you. Hi, Mayor Walker. I was just wondering, on a positive note, what are you most proud of about the way that the city has handled this difficult situation?
Well, the employees have been amazing during this time. They've been able to, under the direction of Dr. Richardson and the leaders, other directors within the city, they've been able to create environments where their employees feel safe. This was one of the points of feedback that we received from the survey that we did about a month or so ago. And almost all of the employees that responded highlighted the decisions that have been made during COVID-19 as it pertains to their safety and ensuring job stability. So that we've done really well, along with some of our key leaders, Fire, Chief Brackney, Khaki, Demick in Human Services, and Sue Moffitt in Social Services, and making sure that the immediate needs of our most vulnerable community members were met. So how we've handled this, and Dr. Richardson can speak more, but the message that he's gotten across to his team about ensuring that we're taking care of community members and employees, that has been noted. And I wouldn't say that there would be any thing that we could do differently. I thought that Mr. Wheeler's creation of Seville 360 was excellent, and it was a way for everyone to get all of their needs and questions answered, and to make sure that we were meeting their needs. There have been some people who still want us doing press conferences, more traditional press conferences. I think after the governor and Governor Northam and at the federal level start doing those weekly press conferences, there was a call for us to start doing more of those. So that's something that we will have to talk about and possibly do better, figure out a better way to make sure that you all are covering what we're doing. But that's what I'm most proud of, the employees and how they've ensured that the community is cared for, and that employees are cared for. Dr. Richardson, do you have like that?
No, I agree. I agree with everything you said. The main thing is that we were able to come together in such a quick manner to be able to stand up our emergency operations and get things moving to ensure, not only, as you mentioned, the community, but also to ensure that our employees were taken care of. And that was one of the key things is, to making sure that everyone felt safe. And I think one of the big things that we were able to do is a lot of our employees were able to telework, and that helped us out a great deal. And we were still able to provide, as I always say, we are here to provide our residents with top tier public services. And we were still able to do that in many ways. Some of them were modified, but we were able to provide those necessary services to keep our city moving.
Thank you. Riley, did you have a follow-up?
Yes. And so I know that you got a lot of funding from the CARES Act, and you've put out different relief funds. But is there a certain way other than these, pop-up testing availabilities? How is the city of Charlottesville helping communities of color that are being disproportionately impacted by COVID-19?
Dr. Richardson, well, so what we have attempted to do to date, the Economic Development Office announced the grant money from the CARES Act of $750,000, and half of that is geared towards minority businesses in the community. We started the 4 tiers of the housing program assistance, where it's geared towards individuals who are housing challenged, people re-entering the community from incarceration, renters who haven't been able to afford their rent, and so landlords will be able to apply for grants on their behalf, and individuals who are homeowners who have been unable to pay their mortgage, they will be able to apply for assistance with their mortgage. The first 3 are grant capacity. This one is a loan. Academic did amazing work in making sure that money was allocated to our most vulnerable community members, and that working with Pacham to make sure that we extended was able to help extend the services of their winter season, and now secure hotel rooms so that people can remain safe during this time. We participated in the emergency assistance fund, and have recently allocated another $400,000 to just the city portion of that emergency assistance fund to help individuals who are, economically challenged at this time, maybe due to a job loss, but there's just so much stress related to COVID that people can fall behind, even short breaks through work, just not being paid for one day, much less weeks. We know that that's impact. So that money is there, as we've been putting money towards causes like that since, those was one of our very first topics of conversation back in March. And then having conversations with our, regional partners when UVA donated the $1 million to the for the emergency assistance fund in a regional capacity, just not for the city of Charlottesville, but that started based on a conversation that I had with JJ Davis and Jim Ryan about that the fund existed, and that how rapidly we were going through that money, and how great the community needs are, right? They still are. So that's what we're doing. I know last week, the conversations with Dr. Bonds, there is a need for her team to have, another team that can do the testing for COVID-19. And she can speak a little bit, more about that, but that is a topic that's in my notes that we have to have. We know for the numbers are going to increase, and she needs to be able to have the contact tracers on hand once people are positive, to try to decrease the potential exposures of people who come in contact with the virus. And if we're talking about increasing testing from the health department, we need to ensure that she has the capacity to do that. So those are things that we are, are doing and having the conversations. And even though it's illegal, and I think everyone knows this on this call, for us to say that something is, just geared towards the Black community or Hispanic community, but it is very important for us, and have always been willing to have those conversations and take those kind of chances, because when you hear the numbers that Dr. Bonds talked about, in the beginning, we have to be very clear about who's being affected by this virus.
I also like to piggyback on that too, Mayor Walker, and the work that Dr. Bellamy, former council member, is doing in the community in collaboration with Dr. Richardson as well as Dr. Bonds and you, Mayor Walker, the efforts that you put in place to ensure that we were testing in the African American community. So I'll let Dr. Richardson probably speak more to that.
So not to belabor the point, but we have had community-based feedback on how to have effective testing, how to be respectful in working with communities, and have been working since March to get free testing out to the most vulnerable communities. And so Centara Martha Jefferson was actually the first one to the table to offer the free testing. And then UVA came along and has offered testing as well. So we've been distributing information to community members in various venues in various ways, to include children's books that help parents explain to their children what COVID is, and to help manage their own anxiety.
And it's also important for, as we talk about the testing. The testing was set up in Washington Park and has been geared towards, people of color. And so it's important for us to understand that increasing the testing and the individuals who are tested from our communities of color is a primary goal of all of ours. And it's very important.
We've got a question from Brielle Ensminger from CIVO Weekly. Go ahead, Brielle.
Can you hear me?
Yep.
Awesome. Thank you. Hi, everyone. Thanks so much for having me. I just had a question for Mayor Walker and Dr. Richardson. So earlier we were talking about large gatherings, specifically regarding parties thrown by UVA students. So as more and more students start to come back into town, I was wondering, are there any options available for city government to control student behavior regarding large gatherings?
So I'll get in trouble, then I'll let Dr. Richardson clean it up for us, okay? So no is the answer, and it's unfortunate. One of the emails that I sent this weekend to council was that in response to another council member's inquiry, or like, what can we do if this type of stuff is already happening with only a few students back in the community? And a comment that I made before is the same one I have now. We need to talk to Governor Northam and President Ryan. I, for one, do not understand why the students are coming back into the community from all over the globe and why we would take that chance. So that has been my consistent comment. It's a recipe for a disaster, and I think it's going to leave us all in a lurch come November when August when they come, and then in November when they leave, and we'll be left here cleaning up the fallout from that decision. And so that's been my position. But as a Dillon Rule state, we have to basically follow suit with the decisions that the governor is making. So we can't do anything other than implore the university to make a different decision. Dr. Richardson?
Yes, and we're supposed to be having a call coming up within the next hour with the university, where they're going to talk more about their comprehensive return to grounds information that pertain to safety, as well as testing and all those other things that go along with that. But just like any other time when we deal with matters with the university, we try to have those conversations to basically provide them with our thoughts in terms of how we feel about certain things that they're doing. So we will continue that conversation and as we move forward, and they do plan to bring students back.
Brielle, did you have another question?
Oh no, that was just my question. Thank
Great,
you.
thank you. And anyone else who would like to ask a question of our panel? We do have another question from Nolan Stout. Nolan, go ahead.
My last question was, have there been any violations issued or any enforcement actions issued regarding these large parties or large gatherings, or any of the complaints that people are sending to the health district?
Well, on the cities and Dr. Bonds, if you want to start, that's fine, and I can go after.
Go ahead, Mayor Walker.
This is my response is Jess, and Dr. Richardson can chime in too. This has been a very difficult time. We've had a lot going on at at once in terms of calls for city government to respond to a lot of things, and we've been very careful about how those responses have been. We've been taking the approach of just getting the message out and having conversations with people about how to change behaviors instead of this very heavy-handed enforcement type, just giving the warnings and hoping people change course. And we've done that because people are getting mixed messages from every level of government, as I have said, and it's very difficult for us to hold people accountable when we are not accountable ourselves. So I think if there was a more, if we were getting a clearer message out to the public, we would be more comfortable with a more firm response. But when you tell someone something and they can point to the cartoonish behavior that's happening at the federal level and the impact that that's having at a state level, and the unwillingness of us to look at this from any other standpoint but the capitalistic standpoint, and looking at the economic undertones of everything, it's been a challenge to then tell individuals to make the best decision possible when the people that they are looking to as leaders are not doing the same.
That's right, Mayor. And I think one of the key things that we need to put out there is that the first step isn't to criminalize. The first step is to educate the public about COVID-19. And many of the folks who were or that we saw were in violation, a lot of them, once you had a conversation with them, they began to realize the safety issues and how it would impact their health. And I think that's key because, as you said, there's a lot of mixed messages out there in terms of what is right and what is wrong. But what we try to do as a city is to make sure that we are providing the right information to the public and to ensure the safety and health of all of our residents in our community. Dr. Bonds?
Yeah, I would just point out that we, as the health department, don't have a lot of regulatory authority over most retail establishments. The one that we do is restaurants, and we are working very closely when we receive complaints from individuals about restaurants not complying with the guidelines. But as both Dr. Richardson and Mayor Walker has said, we really take an education approach to that. We are prepared to carry out further actions if we have somebody who is a repeat offender despite our educational efforts. But so far, all of our restaurants have really been very cooperative and really do want to do the right thing with regard to safety.
Great. Mayor Walker, do you want to wrap up at this point?
All right, no other questions. So again, thank you to our panelists and the press for joining us today, and to the community members watching. And please share this video. It'll be on our social media channels. If you have any questions, please reach out to us. All of us, Dr. Bonds at the Health Department, Dr. Richardson, both Dr. Richardson and myself, and Jackie Martin from Centera, and there's a whole another UVA team that's working to increase testing capacity in the community, and they're hoping to start next week with a 4-day per week testing round at 2 fixed locations, and then there will be 2 locations that they'll choose every week to move around in. And I know one of those locations is supposed to be Mount Zion, over across from the South First Street neighborhood. And so we are going to do our very best as leaders within this community to make sure that we continue to have these conversations, continue to attempt to increase the testing capacity. We know that even doubling the number to 250 that Centera agreed to on Friday is still insufficient for the need that we have. Dr. Bonds has some limitations, and there's funding, testing capacity, and even the ability to get the test results back in a timely manner to make the testing meaningful for you to be able to change the behaviors in a time period. And so there, as per usual, there is this need for more resources than we have. And I think what we have been doing a good job at the city with is making sure that we direct those resources to those places of need to make sure that our community is safe. So we appreciate all of you, all of your efforts, and just know on our end, we're not blaming anyone for any activity, but at some point, I hope everyone understands that my life is dependent upon you doing the best that you can, and I know that your life is dependent upon me doing the best that I can. And as long as we each take that approach, we will get through this. Thank you.
Thank you.
Thank you.